CDHP's been busy over the last 20 years, fulfilling our mission of including dental benefits in the Children's Health Insurance Program, but we've gone well beyond that. We're very proud that we've been part of a coalition and part of partnerships that have expanded coverage to nearly 9 in 10 kids in this country. But we have concerns that the political environment and where we are today have really jeopardized where families are when it comes to their dental benefits. We're asking people to join us today to keep kids coverage and to make sure that over the next 20 years that families have access to care and actually achieve oral health. Your donation goes directly towards building policy options and creating the opportunities for innovative solutions that allow families to get the care that they need.
As a pediatric dentist, I feel as if I'm treating one tooth at a time, one child at a time. Children's Dental Health Project works alongside me as a partner, as a critical ally in children's dental health. They are examining the data, looking at policies, and putting it in the hands of those that make decisions for our overall healthcare system and the care of our children.
I think the Children's Dental Health Project has had an amazing impact. The Children's Dental Health Project helped me and a coalition of Senate offices and national organizations to craft, some would argue, some of the most important improvements in federal law for oral health care that have occurred in the last 30 years. The Children's Dental Health Project were the thought leaders in that. They were incredibly hardworking, they were savvy, and they brought the most cutting-edge knowledge forward.
The impact from Children's Dental Health Project is huge. When we're looking at the policies that affect children's oral health, those aren't always the things that are in the forefront of the minds of those that are making those decisions. So it's always a great thing when we have organizations working behind the scenes for us, making sure that those policies that affect children's oral health and children's lives are put in the forefront.
We aren't alone in believing that prevention is the best medicine. That's why the Children's Dental Health Project addresses the oral health of pregnant women and access to care, because pregnant women have a tremendous impact on the oral health of their child. So we started over 10 years ago looking at access to care for pregnant women because we believe that access to care for pregnant women is important to the oral health of children. And we advocate strongly for early prevention that's based on evidence-based practices and that move us forward in managing tooth decay instead of just treating one kid at a time. We can't do this alone. We need you to consider making a financial contribution to CDHP so that we don't move backwards on the policies that are facing us today, but we look to the future and the opportunities to improve oral health for all families. So please consider making a donation today to make sure that we have 20 more years of success for children's oral health.